thank you all for being here. Thank you guys for joining us. We're super excited to have you here for this virtual career fair. And today we're going to be giving you kind of a crash course in therapy careers at the California Department of State Hospitals. We're going to give you an overview of our department. We're going to share a little bit about each of our 5 facilities in California. We're going to talk to you about what rehabilitation therapy looks like here at DSH. And then we're also going to talk a little bit about salary, benefits, and the application process. And we're going to leave a little bit of time for questions at the end of our time as well, which you'll be able to ask through the chat feature here in Microsoft Teams. Now, who is we? Well, my name is Zach Stover, and I work for the department's statewide recruitment unit. And I'll kind of be shepherding us through this event, so to speak, and I'll also share some information related to our application process at the end of our time. But the bulk of our time is going to be in the hands of some very special folks, and that is our Rehabilitation Therapy Chiefs from each of our 5 hospitals. And I'd like to have each of our chiefs just briefly introduce themselves, and then we'll get into the bulk of what we have for you this morning. And chiefs, if you guys could just introduce yourselves, maybe just in alphabetical order by facility, that would be great.
That's me. I'm Brittany Harris, the chief at DSH Atascadero. I'm a dance movement therapist. I've been with the state for almost 25 years.
Okay. I'm Alan Campbell. I'm the chief at Coalinga State Hospital. I'm a music therapist, and I started my career in the state of California, then moved out of the state, and now I've been back for about 12 years.
Good morning. I'm Yvette Troncoso, chief at Metropolitan State Hospital, and I am a recreation therapist by background. I have been with the state for about 18 years and a half.
Hi, good morning. My name's Camille Gentry. I am a recreation therapist. I'm the chief at Napa State Hospital, and I have been here for 20 years.
Hey, good morning. My name is Katie Zinda. I am the chief at Patton State Hospital. I've been with the state for 19 years and 14 here at Patton.
Awesome. Thank you all. And our chiefs are going to be, like I said, kind of taking the bulk of our time to tell you a little bit more about their facilities and what rehabilitation therapy looks like at their specific facilities. Before we do that, I want to get you guys just a little bit of an overview of what exactly rehabilitation therapy is at our department and a little bit more about our department as a whole. And real quick before we do that, I just want to let everybody know we are recording this event. So this is going to be available later for you guys to go back and review. So if you miss any information, you'll be able to see it. I'll make sure to send that out to you to send you that recording. And I am going to go ahead and share our PowerPoint presentation. So just hang tight while I get that up here. Okay, awesome. So I'm going to be passing things over now for that overview that I mentioned. I'm going to be passing things over to Camille and Katie, who are going to talk you through just a little bit about what rehabilitation therapy looks like at DSH. So Camille or Katie, yes. Whichever one of you, yeah.
Good morning. The state hospitals use a person-centered, trauma-informed care focus of treatment that is designed to help each patient through their personal recovery from mental illness. One of the benefits of how our hospital is set up is that each unit has a clinical treatment team. So each rehabilitation therapist is on a treatment team with a psychiatrist, a psychologist, a social worker, and in addition to a team of nursing staff. They also have each rehabilitation therapist, which is an umbrella term for the different therapies. They get to also collaborate with other rehabilitation therapists in the department. And Katie's going to talk about a little bit more about what rehabilitation therapy is.
As a rehabilitation therapist, we complete assessments and progress notes on all of our patients in our caseloads. We facilitate group and individual treatment, utilizing a wide variety of modalities. And we'll go over that in a little bit as well. We provide diverse, creative, social activities and also specialized hospital-wide events. In addition to that, we help coordinate activities with the level of care staff for when the rehabilitation therapists are not present at work. So we help coordinate those activities for our patients.
Rehabilitation therapist is an umbrella term used by the state of California, and rehabilitation therapist encompasses art therapy, dance movement therapy, music therapy, occupational therapy, and recreation therapy. So it depends on if you meet the qualifications for any of those disciplines, then you're hired into a rehabilitation therapist position. And then you get to collaborate with the other members of the treatment team that we mentioned earlier. So our patients all have a mental illness, and that was the primary purpose that they are here to receive treatment from our hospital treatment teams. They also have become involved with the legal system in some way. We have both patients that are pre and post-trial, as well as patients who are under the Landerman-Petrus short commitment, so they have a civil commitment. We have over 12,000 patients within our system, which makes us the largest mental health system in the world. We have 5 different hospitals throughout the state, and each of the chiefs will be going into greater detail about each specific hospital.
Okay, as rehabilitation therapists, we write treatment goals and objectives for all of our patients. Some of these modalities are listed on this slide that we use. We do focus on areas such as learning coping skills, stress management, relaxation skills, anger management, leisure education, working on emotional regulation, substance recovery, symptom management, social skills, providing things like physical activity, pet therapy at some of our facilities. Each facility has different resources, and we'll talk about that when we go over each individual hospital. But we have things like the weight rooms and bicycles. We have ceramic rooms, art rooms, a lot of physical sport activity places like basketball. We do murals, skill building. So we have quite a few resources for each of our hospitals.
Thank you guys so much. So yeah, that's just a good quick picture of what rehab therapy looks like at DSH. And again, kind of that umbrella term, rehab therapy, referring to our 5 different therapy disciplines. Now we're going to transition to a time where we're just going to let each of the chiefs talk a little bit about their specific facility. We have some pictures to show you guys of each facility as well, which is really cool. You'll get to see some of the resources, maybe some of the patient art, what the spaces look like that this treatment is actually happening. And we're going to do that starting with Brittany from Atascadero.
Thanks, Zach. Atascadero, as you can see from the picture, is very close to the coast. We're about 20 minutes away from the ocean, and maybe 5 or 10 minutes away from vineyards. So you got a lot of tourists that come to this area. It's a really beautiful place to live and a beautiful place to visit. There's lots of outdoor activities. lots of community activities, concerts in the park in almost every little town along the coast. It's a really good place to live, and we really like when people come to visit us that we can show them the area. We're available for hospital tours as well. If anybody wants to come here as a prospective employee and take a tour of the hospital, please reach out to me for that. I'd be happy to show people around. Gonna go to the next slide, Zach. Thank you. This is some of the treatment areas in our facility. I was a little bit blown away when I first came here a long time ago about how well resourced the state hospital is. We have a full-size gymnasium. We could play full court basketball. There's a weight room, there's exercise bikes, there's an outdoor courtyard with a walking path, a softball field, a soccer field, like body weight exercises. Our art center is enormous and has lots and lots of resources as well. We do painting, clay, beading, leather work, all sorts of different paper crafts. The music area has 2 group rooms as well as smaller practice rooms, lots of new instruments, or hopefully well-maintained instruments that we can use in our music therapy groups. Sometimes those folks go out and about in the hospital too. We do drumming in the courtyard sometimes. We do hospital events like talent shows and band concerts with our patients participating. There's a lot of, I think, community feel in our hospital. We try to normalize patients' day so that they are, up and at 'em during the day, either going to their vocational work or to groups, and having lots of leisure opportunities in the evenings and weekends. Don't know if there's a lot more to say.
Oh, that's awesome. Thanks, Brittany. I'm going to go ahead and go now to Alan Campbell, who is the Rehab Therapy Chief at our Coalinga location.
Okay, hello everybody. Coalinga is, California's got fun all over the place. Coalinga is right in the middle of it all. We have the beaches when you drive a little bit towards the coast, or we've got 2 mountain resorts, the Sequoia National Park and the other one, the other national park.
Kings Canyon?
No, it's I can't remember the name of it. It's the one that everybody goes to. Beautiful mountains, and then you go south to go to LA, and you go north to get up to San Francisco, where we have all kinds of things all around us. The other nice thing about the Coalinga area is it's probably one of the cheapest places to live in the state. Our housing prices are a lot lower than other areas, but you can also go get to those areas with a little bit of driving. Now, to talk about our hospital a little bit, Zach, if you want to go through some of the pictures, this is some of our areas. In this one, you can see some of the instruments. We have a really nice music center. It has 2 big rooms where bands can get together and play, and it's got smaller practice rooms and treatment rooms. We've got a large variety of instruments that are used, and we have a music therapist that is in charge of that area. And she does a fantastic job of coordinating all the different groups. The way we do our groups here is that patients all over the hospital can enroll kind of like they would at a university or a college. And they can pick the music therapy, art therapy groups, as well as other types of treatment groups to basically what they're interested in. And so patients from other units can get together and take the class that lasts for usually a quarter, which is about 3 months, and learn leatherworking or ceramics or whatever, and become proficient in those skills. We actually had an art therapist who was a gifted weaver. We have these really nice weaving. You can see a picture of one of the looms. And the patients make these elaborate blankets and rugs and different things that they've weaved themselves. Our art center is enormous. It's fantastic. We have a nice gym as well. Our softball field out in the back, because we're in a very arid area, isn't the greatest, but we're working hard to improve that. Right now, it's mostly dirt, but we try to. But one other thing that we have got going here that our patients really love is disc golf. We've used some of our open fields in the back to create a 9-hole disc golf course that the patients arrange in any way they want to make it challenging, and that's becoming one of our very popular groups here. What else about the area? We treat all kinds of different patients here. We have 3 different populations, all mental illness, of course. It's a nice area. Love to welcome anybody here. We have several openings, and we're excited to get some new blood into we've just recently added occupational therapy and dance and movement therapy, and we don't have any of those therapists here yet at that facility, but we would really like to get some. All right, thank you.
Yeah, thanks so much, Alan. Yeah, I got to tour Coalinga earlier this year and really, really impressed with the facilities there. Okay, now I am going to keep moving through. We're going to go south to DSH Metropolitan, which is our location in Norwalk, California in LA. And Yvette is going to share more about DSH Metropolitan.
Thank you, Zach. So Metropolitan is in Southern California, located in LA County, and we are only a few minutes away from the beaches, amusement parks, museums, hiking trails, sporting stadiums. We have a ton of entertainment, so anything that you can possibly think of. We are not too far from the mountains, and so it's a wonderful place to live. Typically, our weather is fantastic. Right now, unfortunately, it's been a bit odd, but normally our winters are still summers, so it's great. Zach, can you move on to the next slide, please? Our hospital is 106 years of age, and we're continuously remodeling. We have approximately 826 beds. Our population consists of Latin Putros patients, forensics, and skilled nursing. We have a DBT program, animal therapy program. Our facility has an art studio, beauty shop, chapel, patient library, museum, and an oasis, which you can see there, I believe, in the picture. Our oasis is a place where our patients can go to, our LPS patients will go, they can enjoy the beauty shop, make appointments to see the beauticians, to have their nails done, go and read books, magazines, they can play video games, watch movies, have snacks. So they love it. It's located in a shaded area. Our therapists facilitate treatment groups with music, drama, and art contractors, and they have drumming, they have all types of groups that they facilitate. Our staff also works on therapeutic murals, which they facilitate and work with our patients to design therapeutic designs to help them with their coping skills. Our LPS patients are allowed to go on outings, so our therapists organize different types of outings to assist with their life coping, social skills, and they also go on home passes. We offer internships in art, music, rec therapists. And unfortunately, right now, we do not have any dance therapists, but we welcome them. We'd love to have a dance therapist to join us. We also provide our staff alternate work schedules so they can work a 980 and a 410. If anyone has any questions or would like to take a tour of our facility, please reach out to me. I'd love to meet you, speak to you more about all the different programs that we have at Metropolitan. Thank you.
Awesome. Thanks, Yvette. Yeah, and I'll just let everybody know too, the contact information for each of our chiefs has been in these slides. We're going to have another slide at the end that has everybody's contact information. So if you want to take a screenshot of that or write it down, we'll leave it up for a while. But then also, I'll be sending out an email later today to all of you guys, just with this same information, with contact information, with a little bit more about our application process. So keep an eye out for that too. All right, we're going to go back up north, and I'm going to pass things over to Camille from Napa.
Hi, good morning, everyone. Napa State Hospital is located in the heart of Napa Valley. We're also equidistant from Sacramento and San Francisco, and it's about an hour-and-a-half drive to get to the beach. So we are in a beautiful location. Our hospital has around 12,000 patients, or just sorry, 1,200 patients, and roughly 2,000 staff. We have 72 rehabilitation therapists in our department, so it's an incredible opportunity to learn and grow from these other skilled clinicians. That's another really big bonus of working at any of the state hospitals, is being able to really learn from other therapists. There's not a lot of other places that you can work in the country that has this large of a group of clinicians to be able to co-treat with and learn from. We have both pre and post trial patients here, as well as civilly committed patients. We have just one program of civilly committed patients. Here you can see some photos of the art studio. There's a photo of staff during our Pride event. We do a monthly special event, both inside the secured treatment area where the pre and post trial patients live, as well as in the program for the patients that are civilly committed. We also have a photo in the bottom right of the music room. And then in the bottom left, we have a photo of our Unbound art installation. That was a community collaborated installation with volunteers from the community, as well as our patients and staff here at the hospital. We like to pride ourselves on doing large events and big projects. My department really enjoys that challenge. Please take down my contact information, and I'd love to give you a tour so you can see our beautiful facility. Thank you.
Awesome. Thanks, Camille. And last but not least, we're going back down south again. We're jumping up and down. We're going to go to Katie, who is going to talk a little bit about our facility in Patton, California.
Yeah, hi. We saved the best for last, Patton. So we are perfectly located. We are we're at the base of the mountains for up like Big Bear. So we're nice, just drive up to the mountains, as well as about a 60-mile drive to the beaches, 60 miles to Palm Springs area, and like about an hour and a half from to San Diego, beautiful San Diego. So we're perfectly located. There's a lot of activities and things that you can enjoy out in our area. We're not too far from Metro, so we enjoy a lot of the same type of things, the activities and concerts and stuff that are available. So Patton State Hospital is a approximately 1,500 bed facility. We are fully secured, so all of our patients are within the secured, and treatment areas are within our secured treatment. We have most of our patients are here primarily for 2 incompetent trial commitment or are guilty but not guilty by reason of insanity. But they all, there's other commitment codes as well that our patients are here for. We have 73 rehabilitation therapist positions right now at Patton. I have 4 supervising rehabilitation therapists and then myself as the chief of rehab. So we have a lot of opportunities for positions here at Patton. We would like to have more dance movement therapists and occupational therapists within within our rehabilitation therapy service. So please reach out. So we currently, for our internship programs, if you're interested, we have a recreation therapy and music therapy internship program that are active right now. And we are working on starting up a dance movement therapy internship. Hopefully in the fall, we'll get our first intern. And then we're also hoping to expand that to art and occupational therapy in the future. Some of the areas and treatment spaces that we have unique to Patton is we do have a swimming pool. We have tennis courts and racquetball courts. We have ceramic rooms with the kilns and painting rooms. We have a softball field, a soccer field. We have a performing arts studio where we have like music therapists do band groups. We also have additional music rooms and a lot of different resources and musical equipment and art equipment. Here are some of, there's a few of these pictures here are, one is of the museum. We actually have a very nice museum here of Patton. Patton's been here since the 1800s, so it's got a lot of history. And then some of these other pictures are of our enhancement services, what we call enhancement services area in our vocational services, where we have something called Easy Street, and it's where patients can kind of go and they can work on community integration. So there's like a market in there, there's a bank in there, there's a bus in there. They have modules like ATM, sorry, I can think of it in ATM. So it's a really cool treatment space that we can take our patients so they can learn those skills for when they do go back into the community. We also have patient libraries. We're incorporating pickleball into our tennis courts now. So we actually have a lot of really cool things that we can do with our patients. And if you have any questions, please reach out to me.
Awesome. Thank you all so much. Katie, thanks for sharing with us about Patton. Easy Street is such a cool concept and such a cool thing to see. And I've heard of it before, but I hadn't seen these pictures before just the last couple of days. So it's really cool to get to see it. Awesome. Well, yeah, so that's a really good, that's just an overview for all of you who are here of each of our facilities, and obviously some of the unique resources that each of our facilities have, as well as the location of each of our facilities. And we are kind of scattered throughout California. What's cool about DSH is we are one system. So once you work for one facility, you're in the system. So we do have people occasionally who go from one facility to another facility, either for a promotion or for a transfer to be closer to family, whatever the case may be. That is an option that's open to you guys. And kind of on that note, I want to talk just briefly about some of the benefits and the salary that we have available for you guys. So first, just want to talk about the salary briefly. It starts at $80,000 a year, and you have the opportunity to earn up to $94,000 a year right now. And your ability to reach those higher numbers is based on the time you've stayed with the department. So there's opportunities for yearly increases that are merit-based, and then also yearly raises that come as a result of bargaining contracts that the state has with the union that represents all of our rehabilitation therapists. So that's the salary information. In terms of benefits, obviously you'd be working for the state, so you would have access to all of the state benefits. That includes CalPERS retirement, which is a pension plan. They call it a defined benefit plan, where you have a set formula that's calculated based on how long you've worked for the state, and you get a pension check every month once you retire because of that. We also have options for both a 401k and a 457b, and those are tax-advantaged retirement savings accounts. You can have both. We also have excellent medical, dental, and vision benefits, and that's for you and for all of your family, for your dependents. I think it was mentioned by a couple people, flexible schedules. So a lot of our facilities offer either 4 10-hour days a week, or we have another alternate schedule that's called a 9-8-80. Essentially, the way that works is you get an extra day off every other week, and then you work a little bit more on those other days. And then one more thing that I know Katie mentioned, and others as well, is opportunities for advancement. So we obviously have our rehab therapist positions, but there are supervisory positions. There are obviously the chief positions, which are spoken for right now, but those things obviously change over time as well. So lots of opportunities for growth, for advancement, for moving forward in your career. Next, I also want to talk to you guys just a little bit about what it actually looks like to join our team. So I'm just going to give you a brief overview of our application process. And obviously, this is just going to be a high-level overview, so I'm not going to get into a lot of the details of how this actually works, but I'm going to give you guys enough that you can understand and kind of be exposed to the process and then go from there. And to that end, I just want to make sure to reiterate, we're here to help as you're looking to apply, as you're looking at the process. We want to help walk you through it. So I myself am available. Members of my recruitment team are also available. And then the Chiefs are obviously super willing and excited to help you guys out as well. So with that being said, I'm going to jump into this. Oh, and if you do have questions, feel free to go ahead and start writing those in the chat. We're going to do a bit of a Q&A time once this is done, once I'm done with this portion. So either be thinking of your questions or even start writing them out, and then we'll get them in there. So how to join the team. Just a little bit about what to expect for the process. So this is just an overview. It's basically a three-step process. It starts with searching. So searching is how you actually find jobs to apply for. And you do that using the state's jobs website. It's Cal Careers is what that website is called. And you would get there by going to, you could just Google Cal Careers and it would be the first option there. The website is also jobs.ca.gov. So you go there and you would search for positions that you're interested in. So if you're looking to apply for a rehabilitation therapy position, you would search for rehabilitation therapist. And all of our positions are going to be under that umbrella of rehabilitation therapist. So once you've searched for a job, then you're going to need to actually take an assessment. And this is our way of gauging your experience. So it's not like a test or an exam that you would have taken in school. It is called an exam, but it's a little bit different because it's based more just on the facts of your experience. How long have you done this? How much experience do you have doing that? It's a very straightforward thing that's just based on your career up to this point. And that includes your education as well as any work experience. So we hire people who are just out of school. We also hire people who have been working in their discipline for decades. And we don't, we hire people from all walks of life and all stages of rehabilitation therapy. Once you've taken that assessment, you'll be given a score. And once you have your score, you'll be able to apply. So you'll do all of this again through this same website, this Cal Careers website. You'll use that website to fill out your application. And that application will be for a specific vacancy. But once you've taken the assessment, you can apply for as many vacancies as you want. So you'll take the assessment, you'll get your score, then you can go apply for vacancies at Patton, at Napa, at Metro, at all of our facilities. Now, I do have just a couple of screenshots here of the Cal Careers website, just so you can see, first of all, what the homepage looks like. That's the one on the left there. And then on the right is a job posting. So this is once you've searched for rehabilitation therapist, you've found one that looks interesting to you. So this one is an art therapist position at Metropolitan, and you'll see all kinds of information on there. And just a couple of things for you guys to remember to be aware of as you're looking for these positions. You want to make sure you search for rehabilitation therapists. So again, that's kind of our umbrella term for all of our 5 different therapy disciplines. But you want to make sure you use that in your search so that you don't miss any opportunities. Pay attention to the location. So make sure you're looking, if you want to apply at a specific location, make sure that you're looking at that location. And another thing is take note of the final filing date. So each of these job postings has a final filing date. Some of them are going to have a deadline on them. A lot of them will say until filled. That just means that this is an open posting that's going to be open until all of those positions are filled. And some of these postings may represent multiple vacancies as well. So just keep an eye on that, just so that you know if there's a deadline that you have to meet in order to get your application in. So that's just a real quick overview. And again, that's super high level. I'm going to be sending out information to you guys, both contact information and a little bit more detail about that process. But we do want to be here to help walk you guys through that because it can be pretty complicated. Working for the state is awesome. It just does take a little bit of work to actually get in. And we don't want you guys to feel that that's a barrier at all. So we're here to help. With that being said, we are going to go into a time of Q&A. And I see there are some questions that have been coming through here. And I see also that Camille has been answering them, which is awesome. So I'm going to go ahead and just start reading these questions out, starting with the most recent because it has not been answered yet. And this is from Maya. I'm a junior in college studying psychology and ceramics. Are there any internships available for art therapy at any of those locations, and specifically Southern California? And that is an awesome question, and I'm glad you asked it because I did want to talk about internship opportunities. So if someone from Southern California wants to answer that question, that would be great.
Metropolitan actually does have an art therapy internship program, and we are continuously accepting interns and practicum students.
I do want to ask, it's wonderful you're studying psychology and ceramics. Is your degree going to be in art therapy? Or is your education going to allow you to register with the art therapy board? Would be another piece to be mindful of because there are specific requirements that we would need here at Napa before we would be able to accept you as an art therapy intern or after you finish your degree.
In following that, I want to share that we do offer volunteer positions. So if you do not meet the requirement of an art therapy student for an internship or a practicum, we do have multiple positions as a volunteer where you can actually work on the units with the treatment teams and the different therapists.
As the other facility in Southern California, we do not have an art therapy internship yet here.
Katie, maybe you could talk about the internships that you guys do have.
At Atascadero, we take music therapy and recreation therapy interns right now.
Yeah, at Coalinga State Hospital right now, we have internship programs for recreation therapy, and we are ready to open our internship program for music therapy. And that's all we have at this time.
At Metropolitan, we have art, music, and recreation therapy.
At Napa, we have all 5 disciplines: art, music, dance movement, recreation, and occupational therapy. And great, Maya, I'm glad to see that you are specializing in art therapy, so that will open up opportunities for you within the state of California.
And we do have a question here. Oh, I'm sorry. Sorry, Katie, go ahead.
That's okay. I mentioned this already, but at Patton, we have recreation therapy and music therapy internships that are active. We are looking to start a dance movement therapy one in the fall. We're trying to work towards hiring. And those are the 3 that we have right now.
Awesome.
For the
there was a
question
question. Oh,
about
no, go ahead,
kinesiology?
Brittany.
About
Yeah,
a kinesiology major, is that what you were going to ask, Zach? We have had a couple, I think we've had 3 in the last few years, alternate route recreation therapy interns. So if you have a degree in a related field, you can go through NCRTC. I'm going to get that wrong. You rec therapists can correct me on that.
And
It's
NCTRC.
And do an alternate route recreation therapy internship, which is longer. It's almost a full year. And we've had really good luck with doing that, especially with people in related fields who are local to our hospital.
Also, I know that the program, we have a dance movement therapist who had a undergrad in kinesiology and then went back and got a master's in dance movement therapy. So depending on what your long-term plan is, there's a lot of opportunities with that major.
So there was a question here, which I think we've kind of started to answer. There's a group from Dominican University in the art therapy program, and they were asking about internships at Napa. And Camille, maybe you could talk a bit just about how someone would actually get into an internship, what the application process would look like. Would they need to get in touch with you or somebody else?
Yeah, you can definitely reach out to me to start because my information is going to be very accessible. Thank you, Zach, for making that so easy for our attendees. And then our positions here at Napa are student assistant. And so that is the route that we use for our internship positions, as well as volunteer opportunities.
Awesome. I'm just going to move to the next slide. Anyone who has questions, feel free to keep them coming in, but I just want to have the contact information up here for you guys to have a chance to write it down or screenshot it. Oh, and Alan, I think I forgot to put your phone number on there, but I'll get that out to everybody in the email. There was a question here from Simon. Are there any internships for dance movement therapy for foreign students?
We would be willing to accept a foreign student in our dance movement therapy internship. I put it in the chat, but we are about ready to do a advertisement for student assistant dance movement therapist. So if you are interested in that, you can email me and we can make sure that you get that information as well. So wonderful. I'm happy to hear of your interest.
Awesome. Well, I'll give everybody just a minute or two to ask any other questions they may have. I did have a question that I was just going to throw out there for any of you who'd like to answer. I'm curious if you guys could talk about what kind of training opportunities or like presentation opportunities are available either at the facilities or through the facilities, conferences, summits, anything like that.
We have a forensic conference at Patton. It's an annual conference, and it's a pretty big conference that we have provided here. And that's usually 2 days in around, I want to say around November timeframe. And that's a great opportunity. That's for all of our clinicians and people from the outside too, to be a part of that conference. We also have like opportunities within the facility. We're trying to get for Patton, we're trying to start, we used to be able to do like offsites for just our recreation therapists. And now that the COVID we're moving a little bit beyond, we're now trying to plan another but an onsite where we're just doing some educational opportunities for our staff within our facility. And then we also provide one statewide, what we call an RT summit. And we used to actually rotate that around to the different facilities, and hopefully we'll be able to do those back in person, but they have been WebEx. So we've had a lot of opportunities for like trainings within our facilities. And we've also had other trainings like DBT trainings and substance recovery trainings and other opportunities for our staff to be involved in.
At Metro, we also have multiple types of trainings, DBT training. We have an annual multicultural training that we offer. We are constantly in our department trying to come up with different types of trainings that would benefit our staff. We have hospital-wide trainings that are offered to our staff. We also have continuing education, which is offered statewide, that you can participate in classes online, and there's also opportunities for presentations. Our interns are regularly presenting at our hospital-wide meetings, and we are open and always willing to come up with new ideas and taking our staff's recommendations into consideration of certain types of trainings that they'd like to receive.
There's a question here from Joey, and this would be for you, Yvette. Which rehab therapy positions are available at Metro right now?
We have all 5 available.
Awesome.
So we have quite a few positions available, and we are looking to fill them.
So yeah,
that
Joey, oh, go ahead. Yeah.
So that the guests can understand, the chiefs take applications from all 5 disciplines when there's a vacancy and then interview to hire the best candidate. So unless it's for a specific, at least here at Napa, off-site position, like the person that manages our art studio, we only hire an art therapist. But other than that, when we have a vacancy, we accept applications from all different types of therapists and then hire based on the interview, response to interview questions and reference check.
And just in case someone joined us late, those 5 disciplines are art therapy, music therapy, dance movement therapy, recreation therapy, and occupational therapy.
And I do see a question in the chat regarding CODAs. So we do not hire CODAs. We only hire occupational therapists with a formal degree. And a lot of the restrictions are surrounding how the civil class or how the classification system is set up in the state. So we are required to follow those minimum qualifications, which is all on the CalCareers website that Zach had up earlier, and that will likely be in the email that he's sending out.
Yep. Yeah, absolutely. Another question related to transfer. So this would be both for people who are current DSH employees or anyone who's just curious what it looks like to move from one facility to another. Is the process of transferring between hospitals the same as reapplying and starting fresh, or is there any kind of specific thing someone would need to be aware of for that transfer process?
So once you've passed your probationary period, which is a year, you do not need to take the T&E or the training and education assessment. When Zach was going over that high level interview, it was that first part that you had to complete information on your training and experience. That once you've been hired and worked at a DSH facility, you no longer have to do that. So you would just apply for a position at the hospital that you're wanting to transfer to when they have an advertisement of a vacancy.
Awesome. Another question related to music therapy. Just wondering if there's any opportunity to shadow other clinicians or groups as a music therapist.
Yes, as I shared, we have volunteer programs where you can specifically ask to shadow a music therapist, and they will partner you up with a music therapist if there is one available, so that you can shadow them and see what it's like on the units.
Question here, are there any jobs available for college grads in Sacramento? So we do in our department have positions here in Sacramento. They would not be therapy positions or really any clinical positions. So here in Sacramento, it is basically our administrative headquarters, and I actually work here in Sacramento. And yeah, we do have more general like admin type jobs here, but nothing clinical, nothing related to therapy. So if that's the person who asked that question, if that's something you're interested in, maybe just shoot me an email directly, and I'll put my contact info on the screen as well. Or you can just respond to the email that I'm going to send out after. But yeah, I could help you out if that's something you're interested in here in Sacramento. Another question, what if you were a previous state employee, occupational therapist, or maybe office technician, I'm not sure, that left 18 years ago and wants to go back? Would the application process be the same?
Yes, the process would be the same. Just filling out a standard application and submitting it to the hospital of your choice when there's an advertisement that we're accepting applications.
Yeah, the big difference.
It's what's called a reinstatement.
Okay. Yeah, the main difference I think would be you'd be using the online interface, whereas 18 years ago, you probably would have been printing things out and mailing them in. But yeah, in terms of the actual process, yeah, same deal. What population of patients are in the metropolitan location, Yvette?
We currently have LPS or civil commitment patients. We have forensic patients, and we have a skilled nursing area currently.
Awesome. Well, I will give just a last call for questions here. We have about 5 minutes left in our time. I'm going to switch the slide just to show my contact information or my team's contact information. So I'm going to send out the email today from my work address. So if anyone has questions for me, they can respond to that. But this is kind of our general recruitment information here. So if you email this inbox or call that number, it will ring all of our phones and we all get those emails. So my team is about 6 people. So we're here to help with any questions related to the application process, anything related to pay and benefits. And then also we can help get you connected with the chiefs to help with any specific questions related to the facilities, treatment, all of those types of things. One more question came through here. Do any locations work with psychiatric nurses?
All of them.
All the hospitals.
Yep, a resounding yes to that one.
And if you are a psychiatric nurse, we will also take your application. We're certainly hiring for nurses as well.
Yep. Do OTs see clients for feeding problems?
Yes, they do. They work in tandem with, actually, the group of supervisors that are on this call right now and who we're hiring for are the more psych focused occupational therapists. We do have occupational therapists that work in our more physical rehab team. So you would not be, your job as a psychiatric occupational therapist, you would not be working specifically on feeding problems.
All right, I think we will let that be our last question for today. And I just want to wrap up the time by saying thank you to all of our attendees for coming and for asking such great questions and for paying attention while we were talking. And I also want to say thank you to all of the chiefs for the information you presented, for answering the questions, and just for being here. Like I said earlier, this meeting has been recorded, so we are going to make this available to all of you who attended, as well as to anyone else who registered or who may be interested in the future. So keep an eye out for that. That email with a link to the recording will probably come a little further down the road, but I'll be sure to send that to all of you guys. And also, as I mentioned, I'm going to be emailing everybody with the information that we talked about today related to the application process, as well as the contact information for all of our chiefs. I have to take a friend to the airport, so I probably will send that email later this afternoon, but keep an eye out for that as well. Thank you all for being here. To the chiefs, thank you guys so much. Really appreciate you and your time. And that concludes our time here.